Minutes for Tyler to choke, seconds for Alice to hemorrhage.
That is the Paramedics of BC latest public service announcement. Lynda, we have spent a lot of time talking about the concerns that every British Columbian has over how the response times have been concerning and what the government of BC might be doing about it.
Because, Jody, if your child stops breathing or if your husband's having a stroke and you call 911, you want an ambulance to get there immediately. And we are seeing way too many instances where the paramedics cannot get there. And the reason is because they just don't have enough staff and they are burned out. So I've been talking to BC paramedics for several months now. We wanted to invite now into the studio Troy Clifford, who is the president of Ambulance Paramedics of BC. And Troy, I invited you in, and now I'm the one who's at home because I'm sick. Thank you for coming in. I see that Jody has poured you a glass of wine, but let me just ask you this. I mean, how critical is this situation? Because whenever you turn on the 6 o'clock news, you hear another story about someone laying in a back alley for several hours waiting for an ambulance. How would you describe the situation?
Well, your opening really is, first of all, thank you for having me on. I really appreciate the hospitality and the opportunity to have a conversation about this. And you're right, we've been hearing this far too much. Every day we're hearing these situations, and it's really wearing thin. The situation, to give it a word, is dire. I would say that we're in a situation where it's we're on a crash course to a dire situation that cannot be sustained.
So what is it at the root? If you had a magic wand right this second and you could wave it, because all we keep hearing is Band-Aid, Band-Aid, Band-Aid. Yeah. No pun intended, by the way.
Yeah, no, exactly.
Right? But it's like, what's the first domino that needs to fall here?
Well, I think the recruitment of paramedics to fill the vacancies, and we're not competitive against our partners in police and fire and public safety and health disciplines like nurses and sciences. And the reason that, and when I say not competitive, is that we're about 30+% behind in base wages. So really? That's what's happened over the last 10 to 15 years, where we have not progressed and been able to stay competitive. And now we're in this human resources crunch in every profession, in the private industry, and we just can't recruit people when they have choices. So they're not coming into our profession, even though they may want to be. They're coming out of training courses and they're choosing private industry or other professions, RCMP, police services, nursing, health sciences. So that's what's happening. The bottom line is we're not competitive. And that's not getting
So Troy, here's the thing. If you don't have enough paramedics because they're not getting paid enough, and it's a tough job, that means that you have ambulances, but they're literally sitting empty. I don't think people know that.
They're literally, and that same number that we just talked about, 30%, on any given day across the province, including the Lower Mainland, but in towns like Valemont, we're seeing 30 to 50% of the ambulances parked, like Lynda was just saying.
30 to 50%, Troy?
Yes, and you know, it's worse on weekends. And we've seen incentives, we've seen that, but you can only thread people so much. They're already maxed out in the Lower Mainland in many communities. So what's happening is they're getting burnt out. Yeah. They're asked to work more overtime. Yeah. And we're seeing numbers.
Let's talk about the things that are burning people out. Because, I mean, sitting at home, it's easy to say, well, it's always worked. I mean, we call 911 and the ambulance comes and we can count on the paramedics to be there. But then you add on a pandemic, an opioid crisis, a mental health emergency, plus the level of poverty and the literal stress that people are living under in such a larger sense than perhaps ever before that we've seen. And then you add into it, you've got the need to stay home. Look at Lynda staying home right now, not feeling well. If a paramedic's unwell, they have to stay home. So you add that on top. You just don't have enough of a pool to pull from.
So that's two things that are happening is our mental health. We know that this job is difficult, but we're the highest of any profession. And that's WorkSafe numbers that we see. That same amount of numbers, about 30% of our members are either off on WorkSafe claims for psychological mental health injuries like PTSD. They're in treatment through our critical incident stress program. They're being managed on self-management through their physicians or their healthcare professionals. So that's 1/3 of our workers paramedics and dispatchers are off or in treatments for. And that adds to that. And then you add on regular illnesses where we're consistent with COVID and flu, and we're into that season again.
Yeah.
Then, you know, and the physical injuries. And so it's wearing thin. They're at their wits' end, really.
Yeah, and can we sort of throw this into the mix as well? There are 1 million British Columbians who don't have access to a family physician.
Right.
You can't even get into a walk-in clinic. ERs are often closed in some parts of rural BC. So that means people are now calling 911 and almost using paramedics as a first line of healthcare.
Which it is. It's the entry point for emergency care and healthcare. And what's being happened is emergency rooms and paramedics are the default. And what's happening when you talk about our call volume been increasing by 6% every year on average.
Yeah.
And in areas like the Fraser Valley and higher growth areas, that's even more. But our resources have not increased that. Our staffing has not increased. So that pressure, there's more seniors in the community being looked after. They're sicker in the community, if you can use that word.
Yeah.
And the mental health, addictions, as you mentioned. People want to blame COVID, mental health, addictions, all these things for the reason we're in this situation. It started 10 to 15 years ago.
So let's
Those
talk
are
about,
what amplified us.
Right. So talk a little bit about that, because I remember the first time you and I chatted, because Lynda, both you and I have talked to Troy lots of times, too many times.
Yeah, unfortunately, not over
issues,
good things.
But meeting you has been great because you're such a good resource for this. When it comes to what were the problems prior to these elevated or escalated issues that have come to the fore, like we would speak about how a paramedic, when they bring somebody into hospital, they have to stay with that person. That you don't just walk in and go, okay, I'm leaving you in the emergency room and we're leaving now. Like there are a bunch of pieces to this puzzle. That,
absolutely. So there's that community support that isn't there. The mental health and addictions that are in the community and across. That's a by itself. Without having physicians, it's almost like a perfect storm. I don't like that term because it's almost like a imperfect storm. You know, it's kind of one of those things. But you know, right now we're seeing the overflowing of Children's Hospital with respiratory. You know, they're everywhere, and the flu symptoms, and you know it's just like everybody needs a break. But that continually puts pressure on our system, and until we can be part of that solution in the community, as part of that primary care, I think that's the conversation needs to happen. How can we make sure that we bolster the foundation of the ambulance service? And you know, we've had a lot of support from the government, this current government, on funding in that. But we need to make sure that we deal with those three big ticket items: our mental health and wellness. That we need to get healthy because we can't help our patients unless we're healthy, mind and body. And
recruitment isn't exactly high when the difficulties
No, it's hard.
Are real.
Yeah, let me just, one last thing. I know you're in negotiations right now. This is a government that just came out and said, we've got a $5 billion surplus. How much money would it take to fix what is ailing the ambulance service quickly?
Approximately $150 million is our estimate to really totally overhaul and fix the ambulance service to everything we need.
And it sounds like with the budget surplus that the BC government has, that's not a big number. Thank you so much, Troy Clifford, for your time. Lynda, stay with you where you are. Thanks, because Troy. We got What the Hell is Wrong with People is coming up next. And one of the things within this tale is one that's close to both of our hearts. We're going to talk about cyberbullying and women, journalists. What the hell is wrong with people? The content continues in a way that we don't want to see on Steel and Vance. Stay with us.
Oh, it's disgusting.